Welcome back. You're watching a CNN IBN special on pneumonia, and as we move forward in the discussion, let's talk about India's immunization infrastructure and whether it is ready to support new vaccines. But before that, may I at this point also take a few questions that our viewers have posted on Twitter. Dr. Arora, let me put the first question which has come to us from Jamshedpur, where a parent is asking what is the right age for administrating the Hib vaccine?
Hib vaccine is started at 6 weeks of age. In fact, this new pentavalent vaccine which has been introduced, I was mentioning, in 2 states. This is given at 6 weeks, 10 weeks and 14 weeks along with DPT and polio. So, hepatitis B vaccine is also given at the same time. So right in the first 3 months of the age, we give these vaccines, and it is most effective before the child is exposed and gets infected.
Professor Ganguly, Hib or PCV, if one has to choose between the two, which is the most effective one?
Actually, there is no choice. Both have to be given together because both are larger cause of the disease. Hib is available because Indian manufacturers, several Indian manufacturers are manufacturing it, and at the moment it is cost effective also and getting into the system. For the PCV, there are 2 international manufacturers whose products are in Indian market, but Indian manufacturers' products are with the Drug Controller General of India for clinical development. So I think in few years it will be available, and Government of India is putting this on the drawing board so that it could also be given. Actually, both should be given. It is not one versus the other.
We have a question from Chennai. A parent is asking, is the Hib vaccine safe? Are there any concerns vis-a-vis that?
There are absolutely. It's a very safe vaccine, and over 150 countries across the world are using it. There are occasional reports of adverse events following vaccination, which can occur anytime, mild fever or local pain. And we must also remember that currently the way Hib vaccine is given is along with DPT. So it is with DPT, hepatitis B and Hib vaccines. All 5 are combined and it's called pentavalent vaccine. And local reactions can occur because of, and swelling and fever does occur, and which is a very common thing, and most of the parents are already used to it. Probably this occurs because of DPT component. Some of the concerns which people have expressed in some of the other adjoining countries, immediately after introduction of Hib vaccine, there were reports that few children died. But the fact is that extensive investigations were done in these, both by national and international agencies, including WHO, and in none of these cases, Hib was the cause of death. And all our neighboring countries reintroduced, whether it was Sri Lanka or Pakistan or Bhutan. So Hib is a very safe vaccine, and a very large number of children within India have already received vaccine, and there are no concerns.
Dr. Khera, Hib vaccine, as we know now, is readily available in Tamil Nadu and Kerala. When do we expect it to be included in the immunization health program and its availability pan-India?
You know, we started this Hib vaccination in the form of a pentavalent vaccination in 2 states, which Dr. Arora made a mention, Tamil Nadu and Kerala. And we have been able to give vaccination to around more than 2 million children since the start of this 2012. Now we are going to expand this vaccination to another 6 states, and the major ones are, we have in state of Haryana, state of Karnataka, and even in the Goa, and even Jammu and Kashmir. So we are expanding to another 6 states, and hopefully we will expand it to the rest of the country.
As I say, every child has a right to live.
Certainly.
It has to reach every child.
Yeah.
So how soon do we see that happening? You're talking about running a few research programs and finding out what is the extent.
What has been done is, because when we started this pentavalent vaccination, there were some concerns raised in terms of the safety. So that's why we decided, because the state of Tamil Nadu and Kerala, they have very good infrastructure. They have a good kind of a case management practices. Their health systems are quite, kind of responsive. So we started this program of pentavalent in 2 states. Now we looked at the other, the other states where the systems were good. So we added, and over a period of time, we will add this vaccination to the whole of the country. under the UIP program.
Dr. Arora, you meet patients every day. How well do parents take the suggestion of giving this vaccine to their children?
In fact, nobody refuses. If you advise a mother who comes with a newborn child and explain that these are the risks to your newborn and these are the vaccines available, people are ready to pay from their pocket also. But I'm talking about those who are seeking, who are a little better off or urban living. But even in rural areas, studies have shown that if the parents are explained what kind of risk their child runs in case they do not get vaccinated, none of them refuses. So the acceptance is very wide, and that's why you find what Dr. Kheda is saying, that in Tamil Nadu and Kerala, after the introduction, there have been beelines in the PHCs because the word spread that a new vaccine has been introduced. Many of the parents even did not know what vaccine has been introduced, but there was a lot of keenness to get the vaccine because they want disease to be prevented.
Is there enough awareness, Professor Ganguly, about this immunization process?
Actually, our primary immunization program builds up a lot of awareness, but as Dr. Arora talked about, that the lowest quartile, 20% quartile of our population, some of them are not so in consonance with the health system at this given moment. These might be distant populations, these might be migratory population, these might be populations living in the fringes, like we have a community in Bihar known as Musahar community. They don't have houses, they don't have televisions, they don't read newspaper, they don't have telephone. They sometimes in the bad times catch rat and eat. Yeah. So, and they migrate from one place to other for living. So these are the we have such populations. We have populations in the tribal areas. So our awareness and communication system need to reach all these segments of population. So wherever our primary health system has reached, we have built up awareness, and our new health system which we are putting in place is intended to reach every Indian wherever they are living. So we will have to be given some time to actually enhance the reach of our new health system.
Dr. Kheda, before I wind up, one last question. What are we doing for the awareness towards the immunization process?
You made a reference regarding awareness.
Right.
We did some kind of a critical appraisal of the program. And it was shocking to understand that the reference which I was making, that 40% children do not get their full vaccinations. And we wanted to understand what is the reason. And the surprising finding was that more than 50% of the instances, there was information gap. Information gap in terms of where the vaccine is available and how many vaccines are to be given.
Right.
And even they had a phobia of injections, or phobia of the adverse event. Keeping that backdrop in mind, the government of India decided that we will create a great demand generation, and we will try to fulfill this information gap all over the country, and we are proposing for a branding of the whole immunization program.
That's it on this special. I thank my guests for sparing their valuable time to talk about this important issue. Pneumonia is among the biggest killers of children under the age of 5, and it is about time we took the threat seriously. Just like we succeeded in eradicating polio, pneumonia should be our next battlefront. Also, stay tuned for our next episode of Saving India's Children, in which we will take a look at how diseases like pneumonia and diarrhea present a major challenge to India. Thanks for watching.